Okay, shear mouth. You might have heard of the term shear mouth. This is when there is a very large angle of occlusion of the tooth. So instead of being I guess normal, the angle goes extremely acutely, and often what will happen with that is that you'll get a structural change in the shape of the horse's head. So particularly here in the palate, the palate will change shape, and that will continue to, it's a vicious cycle of having the shear mouth with the increased angle, and then structural changes in the bones of the hard palate. This is another, I guess this one is quite common. We call this a slant mouth. Often this will occur when there is pathology or some sort of pain in the mouth and the horse is only using one side of the mouth to chew. And we know that the sore side is generally on the lower side of the slant. Parrot mouth, some cases are mild, some cases like this little fellow are really quite severe. So this is called a type 2 malocclusion, and you can get more, as I said, more mild cases, which are here on the bottom right, which is just an overjet, or you can get really severe cases down here that have an overjet and an overbite. So just an explanation of those two terms. So when we're talking about overjet, that's the difference between the horizontal, on the horizontal aspect between the length of the maxilla or top jaw and the length of the mandible or the bottom jaw. And then we have overbite, which is in the vertical dimension, and it's where we have the premaxilla here actually going down and over the mandible, and this causes a lot of trouble because it restricts the growth of the mandible even further. So this is some radiographs of this little horse. So this is actually a post-op radiograph. We actually did surgery on this horse, and he, I guess, initially responded really, really well. We took some wires between the second cheek teeth and ran them forward, and we made a bite plate here. So that every time, this is the bite plate here, so every time this horse chewed, it would be forcing that premaxilla or the front of the top jaw upwards, and the wires that were anchored to between some back teeth would actually restrict the growth of the mandible, the maxilla, sorry, the top jaw, and it gives the bottom jaw a chance to grow forward without interruption and to lengthen. So this is this little horse under general anesthesia, and you can see the acrylic bite plate here and the wires that are taken back to the back of the mouth. This is the opposite, malocclusion 3, which is an underjet. So this is where the bottom jaw comes out further than the top jaw. Just some more photos of what a malocclusion 3 looks like, and commonly it will cause a hook on the first cheek tooth of the bottom jaw. Smile bite. What I would like each and every one of you guys to do is, when you go home this afternoon or the evening, depending on where you are in the world, I would like you to go and lift the lip of your horse and have a look at its front teeth, because it can tell you a whole lot about your horse. It won't tell you anything about the cheek teeth and the oral cavity, of course, but it is a good start. So is your horse's bite flat, or does he have a smile bite or a slant bite, or does he have another disease called EOTRH, which we'll go into in a bit?